My name's Liz Baker. I'm a neonatal doctor here at the Women's Hospital. I'm a PhD student at the University of Melbourne and a student of the Centre of Research Excellence in Newborn Medicine. I work in the research team here at the Women's Hospital, where we're aiming to improve the outcomes of babies born prematurely. Fortunately, survival rates of preterm babies are improving, but we know that they can suffer long-term health consequences as a result of being born early. When babies are born early, their lungs and brains are really susceptible to injury. And sometimes it's the very treatments that keep them alive in the first few days to weeks that can cause injury. This injury impacts on the way these organs develop and can have long-term consequences for babies' health and their quality of life. Cell therapy, which is a term that we use to describe the use of stem and stem-like cells in medicine, has shown real promise in laboratory models of brain and lung injury that preterm babies suffer. We're now at the point of bringing this exciting therapy into early clinical trials. We recently published a paper in the Fetal and Neonatal Edition of the Archives of Disease in Childhood, where we examined some of this really exciting laboratory evidence, but also discussed the challenges that the field now faces. Cell therapy helps to reduce the inflammation in babies' lungs and brains, and help these organs to develop along a more normal path. But what's really fascinating is that cell therapy can actually help to protect babies' lungs and brains' very own stem cells, which then enabled the development of these organs along a much more normal trajectory. But there are lots of questions. What dose of cells should we give? How should we give them? Should we give them into the baby's bloodstream or should we give them directly into the baby's lungs? When's the best time to give these cells? And who are the babies that are set to benefit most from this sort of therapy? We're beginning to answer these questions in a clinical trial called Renewal, Reducing Neonatal Lung Disease with Amnion Cells. This is a really exciting collaboration with CRE partners, the Ritchie Centre, Monash University, Melbourne University and the Royal Women's Research Group. Renewal is running in the nurseries of the Royal Women's Hospital and Monash Newborn. We're the first group in the world to be giving intravenously human amnion epithelial cells in the first few weeks of life to babies who are born extremely prematurely. We're starting with a small dose, and as the study progresses, we'll increase the number of cells each baby receives. It's a small study, but we're breaking new ground. We hope it leads to a larger study where we can evaluate the impact that the cells have on babies' lungs and brains, and whether or not it improves their short and long-term outcomes. Cell therapy is a really fascinating area and we've got so much more to understand. But it's my clinical work that really helps put my research in perspective. It's amazing to see babies who, when they were born, you could hold in the palm of your hand, leave the hospital and go home with their parents. Recently, one of our NICU graduates returned to the nursery for a visit. She's about 2 years old now. And as I recalled the long nights we'd spent by her bedside, doing everything that we could to help her pull through, she took my hand and walked me down the corridor. It's through research that we can strive to make the lives of babies like her better.